One also seeing quite a move higher. But let's get you an exclusive conversation now. Dr. Trehan of Medanta says that the Cleveland Clinic is his inspiration. Healthcare is a business with a soul, and medicine-first attitude will give good returns. Talking to Ekta at his flagship hospital, Medanta Medicity in Gurugram, he says that the focus is to make healthcare as reasonable as possible. So here's a slice of that conversation.
By principle, we do not want to be the most expensive in the market, no matter how high our facilities are. We want to make it as reasonable as possible, keeping in mind that as many people who can access this kind of treatment should benefit. It should not be for the elite. So if you look at our mix, we have all people, the highest people you can talk about in your hierarchy. I don't consider them high or low. But I'm saying that at all economic strata, all educational strata, government, all that stuff, we are agnostic. We want to give the same treatment to everybody because human life is the same, no matter where you come from. So we try to keep it as affordable, keeping in mind that you need a certain margin to be able to, one, renew yourself, which is very important because technology is the backbone, and technology gets obsolete within 7 years. This whole 20-25 crore machines, the company says it's end of life. I mean, these are bizarre things that have happened, but we are in the clutches of international manufacturers. Of course, with this Atmanirbhar, things are improving. We will, in times to come, produce our own MRIs and high-end scans and stuff like that, which we don't today. So we are totally dependent on these companies from around, and they can dictate. They said after 10 years, although the machine can be extended to longer, much longer, maybe 15 years, 20 years, some of the machines, but they refuse to give parts. They say, well, now we don't manufacture parts anymore. So you have no choice. So I'm saying that you have to keep it in mind that the pricing has to give enough that you can renew yourself, you can pay back your debts, and also leave enough margin for growth. So putting this together, I think that around 20 to 25% is the ideal margin which you should have in healthcare, because it's, like I always say, it's not a business, it's a business with a soul. It doesn't have, it's not cold-blooded in any way, it should never be. So for us, medicine first, because I have said it many times, that good medicine will give you good returns, but good business will not give you. So that's the whole.
So will the margins probably sustain at 20%? You've done 20% in the previous quarter. Is that the target?
No, I mean, if it goes up 2, 3, 4%, this is not bad. This is good. It only gives us enough elbow room to create more. But you don't want to cut corners. You never want to compromise the quality of treatment. You do not, and like I said, you don't want to deny people. Because, people who are already on the sidelines, okay, they deserve medicine as much as anybody does. So you try to make it possible in whatever way, how. Now you see, the government has also taken that view with Ayushman coming in. There is the relief, there's a safety net for 50 crore people. And now the government is also talking about increasing that net, and how it should be. People who can afford should buy private insurance. People who can't afford should be given this kind of safety net, which the government has done.
Correct. The payer mix, that brings me to the payer mix since you mentioned government. How much do you probably get in terms of, say, institutions or government-related institutions in terms of payments? And what are the receivables as well? Because many hospitals are actually looking to reduce the percentage that they get from the government or institutions.
I don't think that's the right approach. The approach is that you offer your services at a level that people who can afford and have private insurance, that number increases. But you don't have to deliberately reduce the number of people you're going to service because they are in the government. No, they also, see, how do you recognize the contribution of anybody or everybody to the country, to the environment, okay? Believe it, India, with the diversity that we have, held together for 75 years is a major accomplishment. You know what's happening to all our neighbors. They're all falling apart. So who all have contributed to that? Basically, the bedrock of ours has been the bureaucracy.
All right, that was a very special piece from our series that we have planned for you, Medicine Box, a deep dive into the world of pharma and healthcare. So catch snippets of this conversation all day today only on CNBC-TV18. Let's actually move on and talk about a very interesting note that came through. This is from